Side of the brain tends to control heart rate. Straight down on that side to control that heart rate, whereas left brain tends to be more rhythm. So you tend to have higher blood pressure. Your brain lowers your heart rate. Your brain lowers blood pressure. If you look at little babies, have real fast heart rates because their brain hasn't developed enough to slow that. Okay, so it's something that I'll look for sometimes in a little faster heart rate. Okay. Prone to autoimmune disorders and allergies. Okay, when the brain isn't working, especially that right side, they're stuck on go. Your left brain is your go brain, and your right brain is your stop brain. So when the right brain's decreased, you're just going. When you learn something for the first time, your left brain does it. Learns all the rules and structure, and then your right brain kicks in as you master things. Okay, it tends to take the rules and bends them as far as you can without breaking them. And so when the right brain's decreased, you're just on that go and not the controlling of that. Okay, typical left brain functions, I'm not going to get into all these because it tends to be more things like dyslexia, okay, which is a whole other topic to get into. But when the left brain tends to be decreased. But sometimes the left brain will be decreased and the child will be overly focused and be diagnosed more ADD, okay, without the hyperactivity when it's more the left brain, okay? So just because I'm not going to go through all these, sometimes it may be left brain, so don't just assume if there's a child or something, you know that is their right brain. But okay. Nutritional causes. So get back on track. I look petitioners of attention as well, but causes. That's why this is very structured. It really helps keep me right. Diet can affect behavior. Okay, they actually did a study where they reviewed research between 85 and 95 and concluded that diet definitely affects many children with symptoms of ADD. I've done a whole presentation on diet and nutrition. I was doing a presentation down at the Crossing, which is an alternative school down in Goshen. I had the nutrition alternative treatment section, and the psychologist that went before me, someone asked about nutrition because I was the next week topic, and he said, well, there really aren't any studies on nutrition. So I went and I actually had 25, 30 studies on nutrition, a lot of them out of Europe, but it was amazing some of the changes that you saw with changes in diet. Okay, it tends to be an issue with too many simple sugars. Okay, now sugar, even though it's not good, is better than high fructose corn syrup, which is better than Nutri-Sweet. Okay, yes, high fructose corn syrup is the same typical compound as sugar, but it breaks down faster. It's absorbed faster. Okay, so it's something that it's not the best thing for us. Okay, but sugar is a little more natural than that. I saw, was it Sierra Mist Natural? Now with real sugar. That was their health claim. You know, it's kind of, I didn't think I'd ever see that, but you know, it's something that, and the nutrition you get into, it has some neurotoxic effects. If you look at, it actually breaks down to formaldehyde at body temperature, and they've actually shown that not all of it, of course, breaks down, but one can of diet soda has 5 times, if it all broke down, more formaldehyde in it than the average person should get. Okay, so you start getting into how many cans did they get into. But yeah, studies have shown deficiencies in magnesium and omega-3 fatty acids, fish oils. Purdue did a study in 95, showed 100% of the ADHD boys that they tested had significantly lower concentration of fish oils compared to the controls. Another study that in 2000 showed decrease in polyunsaturated fatty acids in children with ADHD. Positive response with magnesium supplementation in children with ADD. They had food additives and stimulants, MSG, monosodium glutamate, which glutamate is a neurotransmitter in the brain, especially in kids if you start giving them. That's why they give it. They put it in things because it tends to just taste great. Okay. Red dye number 40, fruit punch, etc. It's actually a pancake mix, anything yellowish in color. Okay. It's something that's been associated with issues with focus, but anything red, yellow, orange, it's just kind of crazy that you kind of go through some of those things. Energy drinks, caffeine. How many kids will go take their medication with a Mountain Dew? Okay, here's another question for y'all. How many cans of soda a day does the average school-age kid, so first grade through high school, drink in a day? Any guess? 3? Actually, 3.5 cans a day. 20% of school-age kids drink 6 or more. Yeah, you start going, I mean, it's just amazing. You get into that sugar, and that spikes blood sugar. If you don't eat a lot of sugar, your blood sugar goes up. You get, first you get kind of a buzz, and then you have a crash. Your body releases insulin that actually takes sugar out of the blood and pushes it into the cells, so your blood sugar then drops. You become actually hypoglycemic, so your body gets fatigued and tired. Your brain needs sugar to live, and so your brain actually releases adrenaline, which releases more sugar, and you get a big spike of actually, it's where they get aggressive, violent, and start, kids that get up, they start punching and hitting. So it gets them again real high, and it spikes up again. By then they're eating something else sweet, so then you get this big cycle. Okay, so it's something that kids should eat food the way God made it, rather than things that are processed. Okay? Treatment. Okay, treatment options with ADHD. Chemical action up here first. Sad thing is that's oftentimes the only thing that people are presented with. But there's definitely things you can do environmentally, changing the environment of the child, dietary changes, and the neurological. Okay, that's things that I will get into. So chemical, the problem is it's very non-specific, and the main philosophy behind it, there's been very little change for about 50 years. Most of them are either stimulants, or some of the newer ones are not, are reuptake inhibitors. Basically, both of them, what they're trying to do is just increase chemicals in the brain. Okay, trying to increase production of those chemicals or decrease the reabsorption of the chemicals. So the overall goal is to just bump up chemicals in the brain. Okay, but it's very non-specific. You can't work on, there's not a drug that will just go to the right brain or just go to the left brain or just go to the frontal cortex or parietal cortex. Okay, stimulants, get into Ritalin, Adderall, Dextrostat, Concerta, narcolepsy drugs that help with patients with issues with sleep. Okay. Neurotransmitter inhibitors, Strattera, and there's some other ones out there now. Antidepressants that they're giving kids, Wellbutrin, Prozac. Blood pressure medications that they've had studies that have shown improved focus with, so they might not give it to a child. Multiple medications. Here's another interesting thing. They've only done, and I've seen 3 studies on multiple medications in children, and actually had 2 of them showed worsening symptoms, worse results, and 1 showed no real improvement. So kids where they're on multiple medications, there's really no studies that have shown improvement with more than 1 drug. Okay, so you start going, if they're going to try something else, let's get off one and get on the other. Always talk to the doctor before any changes with that, but studies just have really shown no improvement with more than 1. And so it's something that I'm kind of interested to look at. Environmental. Yeah, children do not have an adult brain. Mm-hmm.
And are those all ones that can be given to kids without studies that they've been tested on kids, right?
Yeah, I mean, there's so many they give without any kind of approval. It's more just off-label kind of medication, which, yeah, it's something. My biggest thing is just to get informed. I'm not anti-medication. There's a time and a place for medical treatment and medication. I've had kids that I've sent to their medical doctor for evaluation if they have issues with focusing on all aspects of the environment. Okay? So it's something that I'm not anti-medication. My goal is to give you information so that you can make choices and decisions. Okay. So yeah, environmental. Children do not have an adult brain, so increasing clarity, defining rules, consequences, and rewards. I don't care if they're 16 or if they're 20 even. Putting a sign up, writing the rules down, yelling, and what the consequences are. Okay, it seems kind of silly, but putting a poster up, I mean, they do that in workplaces with people, so it's something that having rules, having consequences, having rewards, having positive feedback as well. Rather than focus on all the negative. Okay, negative attention is better than no attention. It's something that having clarity, structure, organization, timers, consistent schedules. If I hit a train on the way to work, it ruins my whole day. Even though it's just 2 minutes, it's just something that structure is huge. Having set structure and order so they know what's going to happen. My oldest boy, if he had a piano recital a couple weeks ago, and he did great. He loved piano. We talked about, I want to do it again. Yeah, I want to keep doing it. Next week came around. It was Monday or Tuesday time for his piano lessons. And so we got home from school, got off the bus. And, okay, we got to go to piano. What? I said, no, I have my recital. We don't start again until next year. He didn't realize that it just keeps going on, and so it just ruined his whole structure for that day. Just at the end of the day. So, structure, timer, schedule. Okay, decreasing distraction, removing unpredictable noises, traffic. Take the kid and put him right in the center. Okay, those kind of things are obvious. There's an area in the brain called the thalamus that filters out what we feel, and when the brain's imbalanced or not working right, it affects how that works. So normally, 80% of what we experience never reaches our brain. It gets filtered out. You put your clothes on, you feel it at first, but then it goes away as your brain kind of inhibits that. When the brain's in balance, not working quite right, you feel tags more, certain socks that annoy kids or people. So it's something that if the brain's working better, you're able to cover up some of those things. But that's where you make a little buzzing noise, and air conditioner turning on, and cars driving by, and things that you should be able to ignore. Okay? I've had kids with their own heart rate, their own bodily function, their stomach making noises distracts them from what they're doing. How do you avoid that? Well, yeah. So yeah, strengthening their weaknesses. Sometimes educators tend to teach to their strengths and tend to sometimes ignore the weaknesses. They have difficulty with certain things. My oldest boy had issues with handwriting. And the teacher was like, well, we could just type all his homework out. No. We'll do some things where we type it out if it's a time thing, but we worked a lot with him, and he's gotten a lot better at his handwriting. It's still not the greatest, but here's mine. So it's something that you want to use. You want to still strengthen those weaknesses, but coming at it through their strengths. Okay? Utilize strengths to improve weaknesses. Okay? Dietary. Eliminate all food sensitivities. Okay? Sometimes I'll send patients to Crossroads is a clinic here that they'll do food allergy testing sometimes with patients that I want to look at different reactions they may have. Most common food sensitivities tend to be milk, dairy, gluten, wheat, oats, food starches. Give them cereal and milk and send them to school. You got number 1 and number 2 allergens. An allergy doesn't mean a reaction like coughing, sneezing, those kind of things. It actually can be just more irritation in the body. Okay? So yeah, eliminate sugar, refined carbohydrates, and food additives. What can I feed my child? Usual safe foods: chicken, lamb, pork, fish, obviously maybe that's headless bacon. So those are kind of usual things. Goat's milk, rice milk, soy milk. Different things that you can go on there. At least give you something to start. Now it's not always. Sometimes they'll do food allergy testing, and some of these will pop up, but some of those can be a little less of an issue. Deficiencies. Okay. Supplementation or dietary changes to increase essential fatty acids, flaxseed oil, walnut oil, cold water fish, green leafy vegetables, things kids love to eat. B12, magnesium, calcium. So if diet is an issue, it's so much easier to give them a vitamin than sometimes it is to really get them to eat some of those things. So it's something that it's really hard nowadays to get everything you need. Our food is grown to look pretty and not necessarily have a lot in it. A tomato from grandma's garden may not be quite as big, shiny as one from the supermarket, but they tend to taste so much better. Okay? So, yeah.
You hardly have any vegetable foods down there.
Oh, yeah, I'm kind of trying to get green leafy vegetables, anything bright in color. Those are just kind of basic things. Okay. Yeah, no, that's not a complete diet by any means. Okay? Yeah, you need to get into green leafy vegetables. It's bright, colorful vegetables, fruits as you can get, blueberries, raspberries, things like that. But yeah, by no means is that a complete list.